forwards. This one back.
Okay. So at the outset, I must thank Dr. Vitull Gupta, sir, for bringing me here in an mesmerizing AIIMS Bathinda. And
Podium mic चलाओ यार, कितने podium mic चलाओ? किधर गया?
it's working. So I will be discussing something. It's a sort of concept building type of presentation. I'm not giving you any facts or any data or something more trials. Only the concept building, because the concept building is very important if we want to understand the pathogenesis of non-communicable disease and very importantly diabetes. So mitochondrial dysfunction, that is the key for type 2 diabetes management. We have been talking about management of diabetes, looking at glucose management, looking at other dyslipidemia and other metabolic syndrome related issues, but we never thought about hitting the root cause, that is mitochondrial dysfunction. So just giving you a reference that mitochondria like this one are found inside our cell, but their ancestors would have been free living bacteria. Arachidonium, just 2.5 billion years back. These bacteria, they had endosymbiosis between aerobic prokaryotes and eukaryotes. They used to give ATP to the cell, and cell used to give the food to the bacteria. So that was endosymbiosis. My schema of presentation will be understanding mitochondrial function, basic physiology, mitochondrial dynamics and plasticity, mitochondrial dysfunction in diabetes, mitochondrial boosters, immunoglobulin, the molecule in the practice, and some carry-on messages. I just remember those days of our 12th class or first year MBBS, when the teachers used to say, who remembers mitochondria? The girl sitting in front always raising the hand. And this, I think this still happens. And me sitting on the back bench used to sleep like this when mitochondria was discussed. Friends, mitochondria is an intercellular organelle, and we all have been introduced to it since our beginning of knowledge. Most of the eukaryotic cells, they have mitochondria, except one cell, that is RBC. Mitochondria are important as a source of ATP production, which is vital for all living organisms. More than 90% of your ATPs are produced in the mitochondria. Mitochondria are structurally divided into 4 compartments. These are very important to remember. Outer membrane, intermembranous space, inner membrane, and matrix. And another thing which is very important, mitochondria has got their own mitochondrial DNA. So that has got roughly around 37 genes. And very importantly, mitochondria, we call them as a power station of human body, redox generation. That means adequate amount of oxidative species are generated in the mitochondria, and they remain inside the mitochondria. Because if they leak outside, there will be irregular apoptosis or cellular death. So it regulates the apoptosis, and it is a key regulator of glucose-stimulated insulin secretion. So over the past years, past decades, evidence has been accumulating that mitochondrial function is closely linked to the right from the inception of metabolic syndrome, pre-diabetes, diabetes complications, progression of complications, and end stage of complications. So mitochondria dysfunction is the root cause of all these things. So now just remembering how our food which we consume is being utilized. Glycolysis is the process that occurs outside the mitochondria, that is in the cytosol. Glycolysis is happening, and product is pyruvate, whereas fatty acid oxidation or beta oxidation, that happens inside the mitochondria. Both of these two lead to one thing, that is acetyl coenzyme A and pyruvate. They go towards TCA cycle, and that happens inside the mitochondria. This TCA cycle leads to production of 2 electron donors. One is NADH2 and another is FADH2. So these are the 2 important electron donors. I have digged out these terms from our biochemistry classes, but these are very important. So these are the fuels for mitochondria. ATP production, there has to be fuels. Carbohydrates provides pyruvate, fats provide free fatty acids and acetyl coenzyme A, proteins as a source of amino acids, lactate and ketones. These are the sources of ATP production. Now there is another thing that is known as mitochondrial dynamics. They are not sitting alone. They are doing lot of work. There is lot of fission, fusion, and mitophagy. And what do you mean by fission and fusion? Fusion is when two mitochondria combine together and they exchange their material and they become a super complex formation. So whenever there is need, you will have these super complex formation. Fission is when damaged mitochondria, they are excised from their healthy mitochondria and they are degraded by lysosome. We call them as a mitophagy. What is driving these fusion and fission? Fusion is triggered by decreased amount of ATP availability, yani energy demand chahiye. Increase ATP demand, then there will be fusion. Whereas fission is triggered excess substrate availability like glucotoxicity, lipotoxicity, overfeeding, increased oxidative stress, chronic inflammation, infection, all these will lead to mitochondrial DNA damage. This is another thing which is important to understand the concept. Electron transport chain or oxidative phosphorylation or cellular respiration. There are 5 complexes, complex 1, 2, 3, 4, 5. These are the complexes which exchange their electron. And electron donors are 2, NADH and FADH. They give electron to complex 1 passes to complex 2, 3, 4, 5, and then up to 5. 5 has got ATP synthetase. It is uncoupling protein which leads to ATP synthetase. And there is once electron is being passed, H ions are produced and they are shifted to the intermembranal space. This electrochemical gradient is extremely important for this electron transport chain. So this is very easy to understand. So mitochondria, each and every corner of mitochondria is functioning very importantly. Cytochrome C leads to capsase activation, there is cellular death, H2O2 protein thiol oxidation, gene expression is implicated, AMPK pathway, again catabolic switch, mitochondrial DNA itself lead to inflammation, regulation of inflammation, TCA cycle, cell fate and function is decided by this TCA cycle. Now, what causes pathogenesis of mitochondrial dysfunction? Kaise ho gaya? It happens due to many things. There can be genetic mutation of mitochondrial DNA or a nuclear DNA that leads to damage to the mitochondria. Aging itself can lead to mitochondrial dysfunction, sedentary lifestyle which is rampant in our society nowadays, infection and chronic inflammatory stages. So this is normal mitochondria having excellently working electron transport chain, proper amount of redox rate, our reactive oxygen species are nicely produced, calcium homeostasis is produced, balanced redox potential, balanced apoptosis, these are greener mitochondria. Whereas there is abnormal oxidative phosphorylation chain, excess amount of reactive oxygen species produced, lot of oxidative stress, there is lot of calcium overload, abnormal cell apoptosis and cellular death and injury. What are the diseases which you can implement here? Name any disease. The root cause is mitochondrial dysfunction. Right from your type 2 diabetes, Parkinson's disease, Alzheimer's disease, your aging, cancer and everything, it leads to underlying defect is at the level of mitochondria. So you call them mitochondrial dysfunction? Yes. Now how diabetes is related to it? Diabetes is related to it directly and indirectly both. There is bidirectional relationship. Mitochondrial dysfunction is indicated as there is decreased mitochondrial content, there is altered bioenergetics, there is altered biogenesis, leading to beta cell secretory defect, leading to insulin resistance, and there is more damage to the beta cells. So, and then this lead to complications and worsening of complication, further increasing hyperglycemia, further increasing glucotoxicity, lipotoxicity, further leading to mitochondrial dysfunction. So remember this, our old triumvirate hypothesis of impaired insulin secretion at the beta cells of pancreas, peripheral resistance at the level of muscle, and central resistance at the level of liver, leading to hyperglycemia. But now we know that it is ominous octet and ever-expanding list of these pathogenic mechanisms. Now coming to the basic, mitochondrial dysfunction, how it impairs insulin secretion. We all remember insulin secretion is ATP dependent. Potassium ATP channel ko close hona padega, calcium it has to enter inside through the voltage gated channel and then insulin will be secreted. So mitochondrial dysfunction leads to decreased ATP production in the beta cells of pancreas and there is decreased insulin secretion due to decreased NAD and decreased calcium in the cell, in the beta cells. Now mitochondrial dysfunction also leads to insulin resistance, decreased glucose uptake at the level of liver and at the level of skeletal muscle. There is decreased GLUT4, which are the transporter for glucose entry into the cell. Decreased tyrosine phosphorylation and increased serine phosphorylation. So serine goes up, tyrosine is impaired. Decreased AKT phosphorylation, and there is decreased PPAR gamma complex 1 alpha activity. All these lead to three things. There is LCAC increase, that is long chain acyl carnitine, diacyl glycerol, and ceramides. They are leading to increased amount of insulin resistance at the level of muscle and at the level of liver. So this is normal cell having appropriately functioning complex 1 giving electron to complex 2, 3. So this is an appropriate way, and there is less amount of reverse electron transportation. But what happens in a diabetic cell, complex 1 is hyper functioning. Yani ki you are driving your car in just first gear and pushing on the escalator button. Pushing on the escalator pedal, what will happen? It will ignite lot of fumes and lot of heat will be generated, and that happens. Complex 1 is hyperactive, complex 2 and 3 are down regulated. So there will be lot of reverse electron transport from 2, 3 to back to 1, leading to more amount of reactive oxygen species production, and they lead to opening of these pores which are there in the mitochondria, and these reactive oxygen species just leak from mitochondria inside the cellular matrix and leading to cellular damage. So you can have hyperglycemia, you can have lipotoxicity, leading to mitochondrial dysfunction and biogenesis, and they lead to abnormal liver and muscle steatosis, lead to insulin resistance, defective glucose-stimulated insulin secretion at beta cells of pancreas, leading to micro and macro cell complications. So how can we reverse mitochondrial dysfunction? There are so many modalities, and we are doing it. We are doing it. Only thing, we are not focusing on mitochondrial dysfunction. So the first thing to remember, mitochondrial dysfunction or the boosters for mitochondrial dysfunction is your exercise. Aerobic exercise, anaerobic exercises, stretching exercises, flexibility exercises, all these are extremely important for having your greener mitochondria. Exercise improves the overall mitochondrial biogenesis, decreases reactive oxygen species, improves electron transport chain, increases level of coenzyme Q10, and improves fatty acid oxidation. Also, this exercise leads to insulin improvement in insulin secretion and insulin action also. Now coming to antioxidant, there have been so many literature for antioxidant, maybe coenzyme Q10 supplementation, vitamin E supplementation, omega-3 fatty acid supplementation, but most of these are in phase 1, phase 2 trials, and they are not being replicated in phase 3 trials. We don't know exact route of these administration, how to give them, whether IV or oral, not knowing exact dosage for these antioxidants. But things are now improving. Vitamin E is coming back again in certain subset of patients like hepatoglobin 22 gene polymorphism. They have got lot of oxidative stress and their vitamin E is working. And also you know that NAFLD patient, they do respond to vitamin E. Now coming to metformin, our age-old friend and the backbone of treatment of type 2 diabetes. Metformin basically decreases complex 1 and it inhibits complex 1. It reduces reactive oxygen species formation, activates AMP kinase pathway, and favors mitochondrial biogenesis through phosphorylation of PGC1 alpha by AMP kinase pathway. So metformin has got definite effect through in improving mitochondrial dysfunction. Then again, pioglitazone, our friends, they do have these benefits, decreasing oxidative stress, decreasing inflammation, improving mitochondrial biogenesis, and improving mitochondrial dynamics also. SGLT2 inhibitors, they do these things at the root level. They improve fusion of mitochondria. They improve mitochondrial replication. Also improve mitochondrial quality and functionality. Improves ATP production at the level of mitochondria. And improves insulin sensitivity by decreasing insulin resistance. Now this is the molecule which is still, I must say, that is in infancy, but we are using this molecule because of their, again, good number of benefits. It has got two important effects. One effect is it improves the beta cell function and beta cell protection also. And another is it improves insulin action at the level of liver and muscle. It inhibits complex 1, but partial inhibition, not like metformin. Again, it improves complex 2 and improves complex 3 also. So it decreases reverse electron transport chain. And this molecule, this is how it works, and ultimately it leads to better beta cell function and survival also. So beta cell mass will also improve. And it has got beyond glucose lowering related effect also, pleiotropic effect on improvement of endothelial function and improvement of diastolic dysfunction also. So we have got literature data showing imiglamin has good effect on even release of insulin. 110 time percentage phase 1 insulin secretion improves. 29% increase in phase 2 phase of insulin secretion. Then improves beta cell glucose sensitivity by 36%. And if the chronic use of imiglamin is there, it improves beta cell mass, beta cell proliferation, and suppresses beta cell apoptosis. So the literature is building for this molecule. Probably you can have more and more molecules from this class of glimmin class of molecules. So literature is also showing that it has got salutary effect on non-alcoholic fatty liver disease also. It improves skeletal muscle functionality, just like your exercise mimetics. Also, it has got improvement in endothelial dysfunction and improvement in left ventricular function, specifically left ventricular mass index, and improves renal function. But they are all in smaller and smaller phase 3 trials, and also many mechanistic and rat models. But we do want long-term trials, CVOT trials, and renal outcome trials also. And these are for cardioprotection, and importantly, left ventricular mass index improves, so that has got salutary effect on diastolic dysfunction. So how it is different from metformin? Actually, metformin totally inhibits complex 1, where this molecule partially inhibits complex 1, and that again, metformin leads to decrease in glycerol phosphate dehydrogenase shunt. That means there is increased propensity towards lactate formation, and due to, in many cases, like in those patients who are having hypotension, who are having organ dysfunction, then you are worried about lactate dysfunction, in hyperlactatemia in patient with on metformin use, where this cannot be there in imiglamin. So this molecule is an excellent molecule we are using for the past 1.5 years, and we have seen the results are coming up. But the whole vista of improvement in mitochondrial dysfunction and focusing on the root cause of non-communicable disease is opening up, and we are having more and more agents which are coming up which will be having the target on improvement in mitochondrial dysfunction at the root level. There can be antioxidants which are targeting specifically mitochondria. There are PPAR agonists also coming up, and AMP activators also coming up. Serotonin activating compounds are also coming up, and decreasing or inhibiting mitochondrial permeability transition pores are also coming up. So the carry home messages from my talk is, quantitative and qualitative abnormalities of mitochondria are recognized in the pathophysiology of diabetes. Mitochondrial reactive oxygen species play a major role in perpetuating hyperglycemia and its complications. Targeting mitochondrial physiology at different level is an exciting era of therapeutics. Currently, very few drugs we are having. Targeted antioxidant therapy is coming up, and the class that is glimmin class or imiglamin, the novel molecule from Japan, this has got definite mechanism targeting mitochondrial dysfunction at the root level. And this molecule has got definite benefits and promising drug class in development. Thank you for the patient listening. We can have interactions if you want to have.